Benzene in Europe's gas supply raises health concerns. Europe's energy transition is increasingly framed around carbon reduction, but new research is widening the lens. A peer-reviewed study from PSC Healthy Energy and Stanford University points to a less visible issue: elevated benzene levels in residential gas supplies across parts of Western Europe. The findings challenge the long-standing positioning of natural gas as a relatively low-impact bridge fuel. Instead, they introduce a parallel conversation around indoor air quality, regulatory gaps, and infrastructure risk, areas that have received far less attention in energy policy and corporate strategy. Indoor exposure risks move into focus. Researchers analyzed 72 gas samples from homes in the United Kingdom, the Netherlands, and Italy. Benzene, a known carcinogen, was detected in every sample, with concentrations in cities such as London and Amsterdam significantly higher than typical levels recorded in North America. The concern is less about isolated incidents and more about routine exposure. Small, persistent leaks were identified in around 40% of kitchens, including when appliances were not in use. When modeled together, these leaks and benzene concentrations pushed a notable share of homes beyond both European regulatory thresholds and stricter World Health Organization guidance. This reframes gas safety in practical terms. Industry standards have historically prioritized acute risks such as explosions or carbon monoxide poisoning. Benzene introduces a different category: chronic, harder to detect, and linked to long-term health outcomes, including leukemia. For utilities, property managers, and insurers, this suggests a risk profile that is not fully captured in existing safety frameworks or compliance models. Detection limits and infrastructure pressures. A key issue highlighted in the study is odorization. Gas suppliers add sulfur-based compounds to make leaks detectable, but in most cases outside Italy, these levels were insufficient to signal danger before benzene exposure exceeded recommended limits. That mismatch exposes a structural weakness. Detection systems calibrated for immediate hazards may not account for prolonged, lower-level exposure. As a result, occupants can remain unaware of risks that build over time. The findings also intersect with broader infrastructure challenges. Variability in gas sourcing, aging distribution networks, and inconsistent regulatory standards across countries contribute to uneven exposure levels. For companies operating across multiple European markets, this creates added complexity in compliance, reporting, and risk mitigation strategies. Implications for energy and building strategy. The timing of the research is notable. Europe is accelerating electrification and reassessing the role of natural gas amid decarbonization and energy security concerns. This study introduces a third dimension, public health, into that decision-making process. For building owners and operators, indoor air quality is becoming harder to separate from asset value and tenant expectations. Heating systems, ventilation design, and appliance choices now intersect with both ESG metrics and occupant well-being. Electrification, in this context, is not just a climate lever, but a potential risk reduction strategy. At the policy level, the research points to gaps in how gas composition, leak detection, and exposure limits are regulated. It also highlights the importance of more granular monitoring to capture risks that fall outside traditional safety metrics. Rather than positioning natural gas solely as a transition fuel, the study reframes it as part of a broader infrastructure system with embedded health considerations. For industry stakeholders, that shift may influence everything from capital allocation to regulatory engagement.